Hi, beautiful people. Welcome back to my YouTube channel. If you're sub for the first time, welcome. My name is Sisolona, and on this channel, I create content on faith, on nursing, on health, as well as makeup. These are the kind of content you're looking out for. Please do not forget to subscribe, like, as well as share the video. It means a lot to me. And for those persons who have been subscribed, I see you. God bless you. In today's video, we're going to be looking at penile fracture. Now we're going to try and understand what penile fracture really is. We're going to try and understand the pathophysiology, the causes, the signs and symptoms associated with the conditions, management and prevention. Now let's dive right into the video. What is penile fracture? Penile fracture is an injury that is being sustained to the male genital when in an erect state. Now, the emphasis is in an erect state, okay? It is a traumatic rupture of the corpus cavernosum. Don't worry, I'm going to explain that later on. So, for us to understand more what penile fracture is, it's important for us to look at the pathway of the condition. Note that another name for penile fracture is fractured penis. It's just a layman term, medically referred to it as penile fracture. Okay, now let's look at the pathway or pathophysiology of this condition. Ideally, the penis is made up of three erectile tissues. Okay, now they are the left corpus cavernosum, the right corpus cavernosum, as well as the corpus spongiosum. Now, these three erectile tissues play a major role during erection. Now, in defining penile fracture, I said that the emphasis is on an erect state, okay, that is injury sustained to the male genitalia when in an erect state. That's because when in a flaccid state, that is referring to the male genitalia now, it is quite difficult for it to sustain any form of injury because of how flexible it is when in a flaccid or in an unerect state. Now, what happens, however, during erection is that there is increased blood flow to the male genitalia. And once this occurs, the erectile tissues which are present in the male genitalia becomes enlarged, thereby causing the once flaccid male genitalia to become erect. Now, once this happens, there's a portion of the male genitalia called the tunica vagina that will become thinner and then stiffen. Now, it is in this state that a sudden direct trauma to the male genitalia can now result in injury, meaning any trauma to the male genitalia in its erect state now or any abnormal bending of the male genitalia will cause the now stiff tunica vagina to be torn, right? And in extension, affecting the underlying corpus cavernosum, which is one of the erectile tissues I talked about, present in the male genitalia. Now, having understood the pathway of this condition, that is the pathophysiology of this condition, it's important for us to now know what the causes of this condition is. Now, there are a few causes of this condition, and one of them, which is the most common cause, is sexual intercourse. Now, during sexual intercourse, it can occur when the already erect male genitalia slips out of the vagina and then hits against the symphysis pubis or the perineum. The perineum is that area of the female body or female reproductive organ that is between the vagina as well as the anus. So that area there, if the erect male genitalia hits against it with force, obviously there's going to be an abnormal bending occurring. So that could cause penile fracture. Another is forced flexion. Now, another cause of penile fracture is taekwondo. A taekwondo is a cultural practice where the erect male genitalia, the tip of it is forcefully bent so as to get rid of erection or to change the shape of the male genitalia. Now, it is culturally done, it's a cultural practice. All right. Another cause of penile fracture is rolling over the erect male genitalia. And let's look at the signs and symptoms of penile fracture. Number one, we have bulging or swelling at that site. Now, the site where the flexion took place, there's going to be swelling, obviously, or bulging of that site. Also, there could be discoloration of the skin in that area, and this is a result of bleeding that is taking place underneath. There could also be a popping sound heard or like a cracking sound. Let me use the word cracking sound heard at that region. There's going to also be immediate loss of erection on that side, and there could also be difficulty urinating, okay, because the urethra could also be affected. Now that we know the signs and symptoms, what are the ways of diagnosing this condition? Now, just like normal fracture where bones are involved, even though in penile fracture there is no bone involved, okay? But just like in normal fracture, that you're able to identify or diagnose this condition through X-ray and the likes, it's the same thing with penile fracture. So for penile fracture, you are able to diagnose the condition through X-ray, all right, magnetic resonance imaging as well as ultrasound. Those are the ways you can diagnose that, oh, this person has penile fracture. Now let's look at the complications associated with penile fracture. Number one, we have erectile dysfunction, that is difficulty in sustaining or establishing erection. Also, we have painful erection, if at all the person is able to establish erection. There could be abnormal penile curvature, meaning the male genitalia now assumes another shape, a different shape entirely as a result of the flexion that's already taking place in on the male genitalia. There could also be presence of abscess in male genitalia, as well as plaques, fibrotic plaques present in the male genitalia. Now, how do we manage this condition? Now, I'm going to talk about the home management as well as the hospital management. All right. Now, the home management, take for example, a fracture has occurred. You might not be too sure, okay, but then let's assume you feel something is already wrong. The first thing to do is to apply cold compress to that region. Now you get some ice, place it into a bag, apply it on that region for about 10 minutes to help relieve the swelling, because there will definitely be swelling. Also, you can take some anti-inflammatory drugs like ibuprofen, which will help you with the swelling as well as with the pain that you're going to definitely be experiencing at that time. Now, those are the home remedies, but you don't stop there. You ensure that you go to the hospital. Like I said, the only way of knowing that, I have penile fracture, the only way of confirming is when you go for diagnosis in the hospital, and ultrasound and other scans are being carried out to ascertain that you have penile fracture. So you have to go to the hospital. Don't just stop at home management. Go to the hospital. Better safe than sorry. Now go to the hospital and get treated. Most likely it's going to be surgical repair that will be carried out if it is being confirmed that the person has penile fracture. And once this surgical intervention is being carried out, ensure you stick to every instruction that your doctor tells you. Okay, most times the doctor is going to ask you to abstain from sexual intercourse for a period of time. Please stick to it. All right, better safe than sorry. One thing about penile fracture is that prognosis is usually very good, because after surgical intervention, adhering to the physician's instruction, and then being cared for by the nurses and the staff in the hospital, most times such individuals are able to get back to their normal state prior to the incident that occurred. Now, finally, we're going to look at the prevention. I already stated what causes it. So the only way of preventing penile fracture is by avoiding the cause of penile fracture. That's just now. I hope I'm able to educate us on penile fracture or fractured male genitalia, whatever you call it. Please do not forget to like as well as share the video. And very importantly, subscribe to this channel for more content. Also, if you have any comments or recommendations on question on this video, please leave it in the comment section down below. And until I see you next time, bye, love, and God bless.